Now let's take a little closer look at HIV and AIDS. HIV, the human immunodeficiency virus, attacks the body's ability to protect itself against disease, which is the autoimmune system. HIV eventually will progress to AIDS, or acquired immune deficiency syndrome, on average within about 10 years of HIV infection. This time varies greatly from person to person and can depend a lot on many factors, including a person's health status, the behaviors of that individual, and then medications that are being taken. Since 1996, the introduction of powerful antiretroviral therapies has changed the natural progression of HIV infection to the development of AIDS. Did you know that approximately 1.1 million people in the U.S. are living with HIV infection? It is estimated that over 18% do not even know they have HIV because they've not been tested and they don't have any symptoms. Approximately 50,000 people become infected with HIV every year, and about 15,000 people die every year in the USA from AIDS. Of the estimated 50,000 HIV infections diagnosed in 2011, among all adults and adolescents, approximately 62% were attributed to male-to-male sexual contact. An additional 3% of diagnosed infections were attributed to male-to-male sexual contact in injection of drugs. An estimated 18% of all diagnosed infections were attributed to heterosexual contact for females and 10% for males. An estimated 5% of all diagnosed infections were attributed to injection drug use for males and 3% for females. You see, less than 1% of diagnosed infections were attributed to other transmission categories. This less than 1% includes babies born to infected mothers, blood transfusions, hemophilia, sources such as needle sticks, and sources that weren't identified. To put the numbers in perspective of what causes the spread of HIV in the United States, out of the estimated total of 50,000 people each year that become infected with HIV, over 30,896 are attributed to male-to-male sexual contact, and 1,423 are attributed to male-to-male sexual contact in injection drug use. 13,800 HIV infections are attributed to heterosexual contact, and 3,800 infections are related to injection drug use. 51 of those cases are related to other. So you might be saying, after hearing all of those numbers and statistics, what does this all mean to me? And the good news is, what we should really see is that by using good work practice controls and using personal protective equipment, ordinary occupational exposures are really the minority when it comes to why people get infected with blood-borne pathogens. The majority of the reasons people do are from behaviors that are controllable. So use your personal protective equipment and your work practice controls, and you can be fairly confident that you'll be safe and sound for you and your patients. HIV is a deadly virus that causes AIDS, and symptoms are unreliable and may or may not be present. A person can be infected with HIV or AIDS for many years and not even know it. Only a blood test can determine the infection. If symptoms were present, they might include fever, fatigue, night sweats, weight loss, rash, and dry cough. The HIV virus is fragile and dies within a few seconds outside the body when it's exposed to the air. The amount of HIV present in the body fluid and the conditions will determine how long that virus lives. HIV is primarily spread by sexual contact with an infected person or by sharing needles and/or syringes. Babies could become infected before or during birth or through breastfeeding, but only a fraction of less than 1% of the people contract the virus from providing medical care, and that small number is mostly from needle sticks. HIV is not spread by casual contact like handshaking, hugging, doorknobs, or using the same equipment like toilets or water fountains. There is no vaccine yet, and there is no cure.